The following is brought to you by CHI St. Vincent.
Hey, welcome back, everybody. February is Heart Month, and as part of the CHI St. Vincent Heart Institute's efforts to make innovative research and establish access to advanced care, we're so happy to have CHI St. Vincent cardiovascular surgeon, Dr. Thurston Bauer, sharing more about a collaboration with Penn Medicine and what they've been able to do in this collaboration to help you as an Arkansans. It's pretty fascinating. Thank you so much for stopping by, Dr. Bauer.
Yeah, you bet. My pleasure.
And explaining this. So, first of all, how did this collaboration start, and what has it helped, and what has it done for Arkansans so far?
Sure. I think, so to start, we should say that the NIH, which is the National Institute of Health, one of their primary interests is making sure that the cutting edge of research reaches all of America's people. And you know, previously, Arkansans really didn't have much access to these clinical trials because of the limitations to really large academic centers.
Yeah.
So this initiative has involved 10 hospitals. There's 5 big research centers and then 5 associated centers like St. Vincent's Infirmary.
Okay.
And it's really wonderful because it allows for us to provide the greatest care to the Arkansans that is available in the nation, which is something that I'm really passionate about.
Yeah, you're from here. You know, This is where you grew up, so now you're
homegrown,
able to exactly bring that kind of innovative research and bring it here. Is this common, this kind of collaboration?
No, it's not. This is really a brand new thing that the NIH has brought about over this last couple years, and the agreement is for 7 years. So we'll have a lot of trials to offer Arkansans over that 7-year period.
Explain the importance of this and why this is so beneficial to all of us here in Arkansas, your
Absolutely.
home state.
Well, you know, we at St. Vincent's, we work very hard to make sure that we offer the very best care, and we already do more heart surgery than any other center in the state. So this really adds one more thing that we can do for the good people of Arkansas, but it potentially allows for Arkansans to receive a therapy that may not be available otherwise for years, sometimes 7 years. So it really provides cutting-edge treatment.
What are the trials that are underway right now? Can you give us a preview of anything that's going on?
Sure. With the NIH, we're currently enrolling for a trial for atrial fibrillation, which is a very common heart rhythm that occurs after heart surgery. And we're evaluating whether or not patients need blood thinners in that setting after isolated bypass surgery.
Wow.
Other trials that we're involved in are with ventricular assist devices, which are implantable heart pumps.
Okay.
And we're looking forward to more heart failure treatments and trials in the future.
What are you most excited about moving forward? What is the one thing that you kind of zeroed in on as, okay, this has got me really rejuvenated and ready to go and move forward on this?
Well, I've always been interested in clinical research. You know, I really want to answer the questions that most doctors have, and I want to be a part of contributing back to the medical fund of knowledge. And I'm just so excited that this is going to really bring cutting-edge therapy to Arkansas. I'm really passionate about that.
You guys do great work over there at CHI St. Vincent, and as he mentioned, more heart procedures than any other institute in the state of Arkansas. And
Practice makes perfect.
That's exactly right. Hey, if you feel like you need to get checked out, if you have atrial fibrillation or any of the other things that we just talked about, and you would like to reach out to CHI St. Vincent, the information is on your screen. They'll be happy to take your consultation. Go in there, talk with the amazing staff at CHI St. Vincent and see if they can help you. And thank you so much for helping all of us when we need it the most.
Appreciate it.
We'll see you next time, Dr. Bauer.